Namaste and welcome to our Facebook Live session with Apollo Hospitals, Chennai. Do you often experience pain in the shoulder joint or stiffness of the joint? It could be the signs of shoulder arthritis, and while the amount of cartilage loss varies from one person to another, and so do the symptoms of shoulder arthritis. Today, let us connect you with our expert, Dr. Sivaraman B, Senior Shoulder and Elbow Consultant, Orthopaedic Surgeon at Apollo Hospitals, Chennai. Dr. Sivaraman will be discussing all the symptoms and the latest treatment options available to treat your shoulder and elbow arthritis. So ask all your questions and concerns surrounding shoulder and elbow arthritis, and our expert, Dr. Sivaraman, is ready to answer. Namaste, Doctor.
Namaste.
To begin our session, Doctor, can you please let us know what is shoulder and elbow arthritis?
Shoulder and elbow arthritis is a wear and tear in the shoulder joint and elbow joint. In shoulder, the arthritis can be in the main joint called glenohumeral joint, that is a main shoulder joint. And in some people, we can get arthritis in the acromioclavicular, which is a small joint just above the main shoulder joint. It can be affected as well. It can affect in the younger people as well. It can be affected with the pain in the shoulder joint. It's called shoulder arthritis. And the elbow also, like a wear and tear in the elbow, is called elbow arthritis.
What are the common symptoms of arthritis in shoulder and elbow, Doctor?
The main problem is the pain. Pain is the main symptom of the shoulder and elbow joint. And because of the pain, they may not be able to do the daily activities. And they will be struggling in daily activities as well as with stiffness. Gradually, over the period of time, they may not be able to move the joint as well. The shoulder and elbow will be like gradually they become stiff.
So, which means normal mobility and performing regular daily activities also start becoming difficult?
That's correct, yeah. It's mainly that the gradually over the period of time, they start with the minimal pain, gradually increases to the maximum level of pain. They can't be able to day-to-day activities will be affected.
So, when should one approach a specialist when they see these signs? Is it bearable for a period of time and then they approach the doctor, or right when they see the symptoms, it's always better to see a specialist?
It's better to see a specialist early in stage because it may be arthritis or maybe do something else. Because if the patient having a frozen shoulder, which may mimic like arthritis as well, therefore it's better to see us early. Therefore we can diagnose correctly because frozen shoulder is a treatable condition fully. Arthritis as well, we can treat it to reduce the pain by giving appropriate some treatments. We can just reduce the progression of the arthritis as well.
How is arthritis diagnosed in the shoulder and elbow, doctor? What are the diagnostic tests that needs to be done?
Initially, we will see the patient, examine them, make sure that it's actually restriction of movement as well as this thing, and we will take an X-ray first, X-ray of the joint, concerned joint, like X-ray of the shoulder and the X-ray of the elbow joint to see is there any arthritic changes.
And what is the next step after the X-ray?
After the X-ray, we will see them. It's see what's the stage of the arthritis, like a early stage or the late stage. If it is the early stage arthritis, then we will tell the treatment options are available. Like a physiotherapy might be available option, or if the patient a little bit more advanced stage, we will discuss the options like other non-surgical options. A lot of non-surgical options are available. We will discuss with them, see which will suitable for the patients. We discuss the pros and cons of everything, and the patient can choose the treatment options what they like.
Speaking of non-surgical and surgical treatment options, what are the non-surgical treatment options available to treat shoulder and elbow arthritis today?
The non-surgical options, it's mainly first we will start with physical therapy, like a physiotherapy. If the patient responds to that, then we will give them some exercises along with it to strengthen the muscles around the shoulder, like the scapular muscles and the cuff muscles of the shoulder. If we strengthen that one, then the joint reaction force will be less for them. Therefore, the pain they feel will be less when they do the exercise regularly. With the elbow one as well, we ask them to do the exercises as the pain permits. If the pain is permitting after the physical therapy, ask them to do exercises. That will actually prevent the progression. The other non-surgical treatment options, like we can give the injections in the shoulder joint. Now with the latest advanced technology, we do with ultrasound guided injections of the shoulder joint with the stem cells as well as the PRP injections, Anakin injections. The gel injections are available. Each one provides some relief of pain for some time.
So when you say the chances of developing arthritis, what are the risk factors that increase the chances of developing arthritis in the joint?
Mainly, it's like if the patient have any injury in the shoulder, if they're not treated correctly, like say for example, if the shoulder joint has been fractured, which involving the joint surface, if they are not treated correctly in the first place, they left it without had any surgery, or without they ignored the fracture with the steps and things, that can lead to secondary arthritis. That's one thing. Other thing is like sometimes it's like the patient having any avascular necrosis, like if they having been like some patients are prone to have a avascular necrosis. Those patients tend to develop arthritis more sooner. Recently, some patients with a COVID infection, post-COVID infections, they develop avascular necrosis, a little bit more common we see nowadays in the clinic as well. If you see them early, we can actually prevent the progression of avascular necrosis to the full-blown arthritis. We can do a surgical treatment as well, or a non-surgical as well. We can treat them. Therefore, it will prevent the progression from avascular necrosis to the arthritis.
Can you explain what is avascular necrosis to our audience, doctor?
Avascular necrosis means the blood circulation to the part of the head of the humor, that means the shoulder joint, will be affected. Therefore, the nutrition to the joint is less. Therefore, it's gradually stage goes from one stage to the next stage, progressing to the bone necrosis. That means the bone will go dead without the blood circulation, and then in turn it leads to the collapse of the joint, which can cause arthritis.
When you say risk factors, are there any predisposed conditions which could be genetic, which could be something that the patient has right from birth? Are there risk factors which are predisposed?
Yes, that's like the inflammatory arthritis, like a rheumatoid arthritis patient, and there is a lot of inflammatory arthritis. Those are patients are more prone to develop the arthritis in the shoulder as well. If you diagnose them early and treatments usually taken them early, then they can actually prevent the progression of the disease.
Can arthritis in the shoulder and elbow be prevented, doctor? If so, how can we do it? Is it just lifestyle modifications such as better diet and exercises, or is it something that you would recommend something in particular?
For prevention of the joint arthritis, mainly we need to reduce the joint reaction force. That means whatever the force goes through the joint need to be reduced. We reduce the joint reaction force mainly by strengthening the muscles around the joint. For the shoulders, we strengthen the scapular and cuff muscles. Therefore, the joint reaction force will be less. Therefore, it can indirectly prevent the like a shoulder arthritis. Elbow as well, we mean biceps and triceps. If you strengthen those muscles, you reduce the joint reaction force, indirectly reduces the arthritis. Also, you need to strengthen the bones. Therefore, it will actually prevent any like osteoporosis and things. For that, you need to take the adequate nutrition, like mixed balanced diet along with high proteins, with calcium and vitamin D supplements as well. Those things will help in strengthen the bones. For joint, mainly we ask them to strengthen the muscles, therefore to prevent the arthritis. And also, when you have any injuries in the shoulder and elbow, make sure it's treated appropriately. Therefore, you won't get the like intra-articular fracture, means the fracture involving the joints can indirectly leads to the arthritis in future. If it is there, better to consult an orthopedic doctor just sooner. Therefore, you can like get it corrected. Therefore, you prevent the arthritis due to that.
Right treatment at the right time is
That's correct.
important.
Yes, that's correct.
Doctor, moving on to surgical options, we'll take it in two parts. Can you let us know what are the surgical options available today to treat shoulder arthritis first?
If you come to the surgical option wise for the shoulder, mainly the first option is like for the I told small joint and the big joint. The small joint is AC joint, like acromioclavicular joint, which is a small joint present just above the shoulder joint, main shoulder joint. For that, the surgery wise, we usually give them the first injection first to confirm it that is a joint causing problem. If the injection relieves the pain, then we will do the surgery for them in the form of keyhole surgery for them. AC joint, we can do the keyhole surgery to just remove that acromioclavicular joint. Therefore, the patient will be pain free after that. That's a fully curable condition for acromioclavicular joint. For the main shoulder joint called the glenohumeral arthritis, is a main shoulder joint arthritis. The treatment option wise, if in a younger age group, if a patient like in a very younger age group, we don't tend to give advice a shoulder replacement option for them. We tend to give the option of like a debridement and then the stem cell injections for them, These things will help in the keyhole surgery with debridement will be helpful for them at a younger age. We can do a microfracture, stem cell. A lot of orthobiologies have come now, which will be helpful for them in younger age group. If the patient's got a AVN, we can do a core decompression, which will prevent the progression to the arthritis. That's for the main shoulder arthritis. The patient is in advanced stage of arthritis. If these treatments won't work for them, then we give an option of shoulder replacement for them. Shoulder replacement, there is a reason advances are come through, like we got a short stem shoulder replacement, which we just replace the head of the shoulder with a short stem, which have many advantages. Is like anatomical, like it's fully like anatomical shoulder joint, which give better results for them. The other shoulder arthritis is like treatment replacement is a reverse shoulder replacement, in which the cuff muscles are not working. Then we will give them a reverse shoulder joint replacement, in which we will change the ball and socket to the other way around. Therefore, it works efficiently for the patients with the reverse shoulder replacement.
Doctor, speaking of surgical options available to treat elbow arthritis, could you please elaborate on that? What are the latest advancements and what are the best procedures that will work for us?
It's for elbow arthritis point of view, for a surgical option wise, for elderly patients, like because the elbow arthritis will there is a limitation of lifting weight in the hand. We tell the not to patient lift more than 2.5 to 3 kilos of weight in the hand. Therefore, we usually recommend that for the elderly patients, like more than 65-year-old. If patients are younger patients, we don't recommend elbow replacements for them. Even though elbow replacement gives very good results for them, pain relief and the movements, we don't recommend for the younger patients. We will give them an option of elbow keyhole surgery and with the debridement that give a better pain relief for them. We do a OK procedure as a keyhole surgery as well for them. That give better pain results for the elbow arthritis in the younger patients. And in younger patients, if they want, we do not a total elbow replacement, we do hemiarthroplasty for a patient, like a half elbow replacement. We can do it for the younger patients. We can do that one for the elbow arthritis.
So, when is surgery actually recommended for arthritis, be it the shoulder or the elbow? When does a doctor or a specialist recommend surgery?
We usually go from stage by stage. We'll say that from non-operative, that means from the physical therapy to the injections, and then the keyhole, the keyhole surgery is the next step. If the patient not responding to any of these things, then probably we recommend the shoulder replacement or elbow replacement for them. Normally we'll go stage by stage, but we advise the patient to get the early consultation, therefore they can get the options available, and also they can prevent the progression of disease as well.
And not undergo a surgical procedure also, for all you may know.
That's correct, Jansi.
Doctor, what are the success metrics when it comes to surgical interventions in relieving pain and improving the functions of our patients?
It's a very good results with a shoulder replacement. It's a very rare arthritis in the patients, but those who are having the arthritis, they have very good results with a shoulder replacement. We do shoulder replacements for the elderly patients with complex shoulder fractures as well nowadays. It's like for a humeral head involvement, I mean shoulder joint intra-articular, which is not amenable for a fixation. We tend to do a shoulder replacement, reverse shoulder replacement, which give very good results. We have a track record of about 20 years plus results with very good results with the shoulder. The function is much improved for them. With the shoulders replacement, they can just get the early movements as well.
And what is the duration of recovery post-surgery for this, doctor? And when can patients get back to day-to-day activities?
We usually recommend from day one itself, they can move the shoulder. But for some pain will be there for the full healing. To take up to 2 weeks to 6 weeks, depends upon the patient. They can get to the day-to-day activities within from 2 weeks to 6 weeks.
Will they have any restrictions in terms of not lifting heavy weights or...
For a elbow replacement, yes, there is a limitation that they can't lift more than 3 kilos of weight for the elbow replacement. For the shoulder replacements, once it's well set, then they can lift the weights and everything. Like other normal person, they can do almost everything.
We'll take some questions from our viewers, doctor. My father has been experiencing persistent pain and stiffness in his elbow. Could this be a sign of arthritis? And if so, what's the immediate action that I need to take?
Okay, it's if father having the elbow pain, means it may be due to some other reason. It's maybe due to the most common elbow pain is a tennis elbow. Tennis elbow is one of the reasons a patient can get the pain, or a golfer's elbow can cause pain. If it is, you need to see the doctor, ortho doctor, and make sure that it is due to a tennis elbow or a golfer's elbow, or due to the arthritis of the elbow joint. If it is depends upon what treatment it is. If it is a tennis elbow one, they can do the simple muscle stretching exercises along with physiotherapy will cure the problem for them. And golfer's elbow, the same treatment like options. And if it's arthritis, we need to have an X-ray and then see what stage of arthritis, and then we can give the treatment plan accordingly.
My mother in law has tried various over the counter medications for arthritis pain, but they don't seem to provide her with any relief. The pain seems to be increasing by the day. What are the other non surgical treatment options that you would recommend?
For the shoulder arthritis, if it is not relieving with the medications, we can because usually they may not respond well with the physiotherapy as well. In that case, then we will give injections for the shoulder. We give like ultrasound guided injections of like a PRP injections and autologous cytokine implantation, which is like a Sanakine implantation, which will give very good. It's an outpatient procedure. We will do it as a like come in the hospital, have take the blood. They need to wait for 3 to 4 hours to incubate, take the growth factors, which will give very good pain relief for them. It may last up to 6 months. Some patients have it for pain relief up to 2 years as well. Give very good results for the patients with arthritis of the shoulder.
I'm hesitant to undergo surgery for my arthritis in the elbow. Can you help me understand what should be the next step?
Okay, it's if you're having arthritis in the elbow, we need to see you clinically as well as see the X-rays, and we need some more CT scans to see what causing the problem for you. If it is arthritis, it may be sometimes a loose bodies might be there in your joint, which can cause the pain for you, which can just catch you when you're doing the elbow movements, which can cause a lot of pain to you. For which a simple like we can do a keyhole surgery to remove it might be better. But if you don't want, we need to see you first to see whether what options might be suitable to you. We can give some simple injections which might relieve the pain for you as well.
And when you say keyhole surgeries, it's lesser scar and lesser blood loss and shorter stay in the hospital.
Yes, it's we can do as a daycare procedure. Keyhole surgery in the elbow we can do as a daycare procedure, which like it'll be like a two holes will be there, and then we will just like remove whatever the debris and debride the elbow joint, which will give a pain relief to you as well. So you can get back to your work within like a 2 or 3 days.
I go to the gym very regularly and lift heavy weights. Can this lead to me having any shoulder or elbow arthritis in the future once age catches up?
It's a good question actually. The reason is it's if you do a correct technique, that means it's a you need to do the pre and post muscle stretches before you're doing any exercises. Muscle stretches as well as you need to condition the muscles accordingly. Like if you are doing some pec as well, you need to strengthen the other muscles like a shoulder, scapular, and cuff muscle. If you strengthen it, then your joint reaction force will be less for you. Therefore, it can prevent the other problems of like a future shoulder arthritis. Like the elbow as well, strengthen the biceps and triceps muscle.
I am a tennis teacher and I teach the sport for close to 5 hours every day. As the sport involves a lot of repetitive arm motions, is that a concern? Should I be worried about it? What should I do to minimize my risk of having this as an issue in the long term?
Mainly the repetitive motions in the elbow and shoulder can cause the problems of mainly the like tendinitis. Tendinitis in turn like they call tennis elbow, golfer's elbow, which can cause the problems for them. And but to prevent it, mainly they need to do the stretches, regular stretching of the muscles in the elbow, like extensor muscles and flexor muscles. That will actually prevent the having any problems in the shoulder. But if they're having any problem, like any injury or any pain they develop, it just consult the specialist sooner before they can prevent it progression to the further levels.
So, what would be your message to our viewers who are watching this session today, Doctor?
Mainly to prevent the awareness of the shoulder elbow pain is making. The shoulder pain is the most common problem after the back pain for the among the most of the viewers and the world population. Don't ignore the pain. If you're having pain, if it's not settling with the simple measures, consult the specialist straight away. Therefore, you treat early, therefore you can prevent the further problems.
Thank you very much for an insightful session, Doctor. We got to understand a lot of the symptoms related to shoulder and elbow arthritis as well as its treatment options available today. For appointments with Dr. Sivaraman B, Senior Shoulder and Elbow Consultant, Orthopaedic Surgeon at Apollo Hospitals, Chennai, please contact 044 4040 1066. I repeat, 4040 1066. Thank you very much, Doctor.
Thank you.
Thank you, viewers.